Good evening, Warrensburg-Latham families, teachers, and staff. This is Cheryl Warner, Superintendent at Warrensburg-Latham, just reaching out to you with an update in regards to our return to school plan. And I will say this is a very difficult message for myself and district leadership to send, as it brings us feelings of sadness and discouragement. I am sure that many of you are aware that the Warrensburg-Latham school community has been impacted by COVID-19. We do not have any positive cases amongst our staff. However, over the weekend, we were notified that some of our essential employees were placed on mandatory quarantine due to contact with positive COVID cases. We also did find out that 2 positive COVID cases entered our facility last week during new student registration. Please know that these incidents are nobody's fault, and all individuals in each situation followed all of the guidelines, and all individuals that were in close contact were notified of this. The Warrensburg-Latham staff has done an exceptional job following the ISBE and IDPH guidelines and had an extremely effective and safe process for new student registration. Also, our new Warrensburg-Latham families were wonderful and followed all of the rules and guidelines while registering, and we could not have asked for better. However, unknown situations happen. The 2 positive cases that entered our facility had no knowledge of their diagnosis. They had no symptoms, they had no fever, and they followed all of the rules and wore masks. As a school community, we also have staff that have risk factors, either themselves or individuals in their household that have risk factors of contracting COVID. Our teachers and staff have overwhelmingly communicated their desire to provide in-person instruction, regardless of their unique health situations and risks, because they're teachers. And they just can't imagine not being able to meet with their students on a daily basis in person to provide instruction. However, after last week's events, I'm not sure that we should be asking our staff or their families to put themselves at risk. And I'm not sure that we should be asking families to make a tremendously difficult decision to choose in-person or remote learning, knowing the risks that we could face if we were to open our doors to hundreds of students at this point in time. Last week displayed to us that even though we are doing our very best to follow all of the guidelines, unknown incidents can happen that start a domino effect. This virus is not willing to follow the guidelines of ISBE and IDPH like we are. And if Warrensburg-Latham has any additional staff that are compromised by this virus, we would not be able to effectively educate our students or run our buildings. And unfortunately, we do not have access to substitute teachers as we have had in the past due to COVID-19. In my conversations with the health department, they have shared 2 very critical concerns about why the Macon County COVID cases are increasing significantly. Number 1, there are asymptomatic individuals that are spreading the virus because they are not aware. And number 2, there are individuals that have been quarantined due to contact to a positive case that are quickly going out to be tested and receiving a false negative test. Therefore, they have an increased sense of security, and they are taking themselves off of the mandatory quarantine against medical advice, and that is spreading additional cases as well. So the metrics for Macon County at the end of last week jumped to 114 cases per 100,000, which does, as a county, put us in a warning level, as the target is only 50 per 100,000 cases. The health department is reporting a significant increase in cases overall and a significant increase in cases, especially teens. Yesterday, they did send a statement communicating to all superintendents within Macon County that the public health perspective in Macon County is that virtual learning would present the least amount of risk of exposure to COVID-19. I would like to personally thank the health department for all they are doing to support schools and families. They are receiving calls, emails, and visits from all stakeholders that are attempting to maneuver this pandemic, and they're continuing to effectively provide school leaders with much needed health and safety guidance. And I would just like to thank them for their support and assistance. We would also like to support the health department's efforts and encourage the community to follow the guidelines of social distancing and wearing masks to help stop the spread of COVID-19, as it tremendously impacts our school community. The Warrensburg-Latham administrative team met for several hours on Sunday to brainstorm possible solutions to our concerns from last week, the increasing amount of families that we know are impacted by the virus, and the health concerns of our staff. And we have spent the last several days collaborating with the Board of Education, the Warrensburg-Latham Union, healthcare professionals, other area superintendents, and teacher leadership teams to assist us in deciding the best plan of action for our community. And at this point in time, we have decided that returning to school through remote learning for the first quarter is the best option to keep our students, families, and staff safe. Please know that this was an extremely difficult decision, and we know that many people will be unhappy with this news. We understand the concerns that will be raised and the hardships that will be placed on families when students can't return to school in person. At this point, I feel like we do need to focus on one of the cornerstones of educational psychology, which is Maslow's hierarchy of needs, in which we know that students can only reach their fullest potential of learning after they have met the basic physiological and safety needs of health and wellness. With this decision comes some significant changes. The teachers have been participating in advanced technology training to assist in planning for remote teaching prior to the start of the school year, and they have significantly more training to come. Teachers and administration will be providing students with structured remote learning opportunities, including procedures for attendance, grading, assessment, live and recorded lessons, collaborative sessions with peers and teachers, and also regular consultation office hours with teachers. We will emphasize core instruction, but students will still have access to enrichment and electives as well. Our teachers and support staff will also be incorporating social emotional learning and completing well checks on students. Remote instruction in the fall will look and feel much different than it did in the spring, with traditional grades, due dates, and student accountability. We realize that you will have many questions as we continue to plan for this change. Please utilize the resources on our website to assist with this. Our plan is being updated, and we will continue to strategically release more sources of support and information on the website as we get closer to beginning school. Our first day of remote learning for students will be Monday, August 24th, in order to allow for teachers to plan effectively all of next week. The first thing I would encourage you to participate in is our virtual open house on Tuesday, the 18th, from 6 to 7:30 p.m., and we will share this via the website, email, and also our Warrensburg-Latham app. I've also attached to this message and email our updated remote learning plan for parents and teachers. In closing, I want to thank all stakeholders for the support and collaboration in this process, and I want to ask that we all show each other some patience, flexibility, and grace as we maneuver the impact of this pandemic. The Warrensburg-Latham administration, teachers, and staff will do our very best to educate our students, and overall, we want all families to stay safe and healthy. And to those of you impacted, we are sending you well wishes for a quick recovery for you and your family. Thank you very much.